that was there in the bill, in Obamacare, he can't vote for it. So that's the moderate wing now saying we can't abide some of the things that are in this that are good for the Freedom Caucus.
So the focus until now has been the Freedom Caucus, right? This one block. Well, the focus now is going to move to the Tuesday group, which is the moderate block, and we'll have the same vote counting and careful attention to their votes on this, because it is hard to square the goals of these blocks of Republicans. It's hard to not have these coverage rules. It's hard to cut back Medicaid and get the votes of those moderates. You can't do both.
I mean, the president and the vice president have done a huge job courting the Freedom Caucus. And members of the Freedom Caucus that I've spoken to have said they were impressed by their ability to negotiate, and that's what got them to yes. I mean, the question is still, even if you did manage to get the Tuesday group on, where does this go in the Senate? And so you're asking members of the Tuesday group, the moderates, to sign on to something that may still be dead in the Senate.
And the bill also seems to exempt Congress itself from the waivers of these rules, which is a classic poison thing for voters.
They actually put themselves back in.
How did they put themselves back in?
Well, they carved themselves out. So they took out the language that they were going to protect themselves from some of these provisions, and then they realized that that was an incredibly insane thing to do. So they actually put themselves.
But it's a tell, right?
But remember, the overarching point here, in part, is that Obamacare has become popular with the public. The president's tax plan, of which this is even a worse version than what he originally proposed, is unpopular with the public. So they are not only fighting all the internal politics up on the Hill, they're going to be fighting public opinion on this as well.
So Michael Steele, your party, the Republican Party, is now on the verge, basically, if they're successful in this, basically telling people that, you know, your health is going to depend on what state you happen to be born in.
Right.
I mean, that's the state of national health care right now.
Well, it is, or at least that's what the trend line is, and I think it's one of the dynamics that Republicans are going to have to develop an argument for. How do you go out to the American people and sort of sell this notion that this state may or may not have the level of coverage that you want, so you may have to move unless you have provisions that allow for cross-border insurance, which is problematic in and of itself. There's that. There's also, Michael, the reality that was noted in the piece there, that this is not a full repeal. That's not what was sold to the core base of the Republican Party over the last 7 years, and especially in this campaign, you know, we wanted a full repeal. You presented a full repeal bill to the President of the United States, Obama. You have not done that with the Republican President Trump. The reality there is reconciliation makes that much harder to do. So the Senate, especially in the House, are coming to grips with the new reality of Obamacare. It will be here in some form. There will not be a full repeal because you can't get to a full repeal. And Republicans are now having to dance on that pinhead and come this fall, and especially next year, have to go out to the constituents, the core constituencies, to try to avoid being primaried, et cetera, and explain to them why this is a better deal than the full repeal bill that they sold for 7 years.
As Caddy points out, this might just be another intramural fight where they're fighting amongst themselves. They get a bill out and the Senate says, we're not passing it.
Right, and do you want to be the person that signed onto a bill that's going to die, if it's going to make you unpopular and at the risk of being primaried?
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.